Hey, it's Dr. Schmidt. So what I want to share with you today is this idea from the last video about the FTC is shutting down the cures for actually many diseases, but more specifically COVID-19. So here's a graphic I got off of Twitter, and it's comparing Turkey, Algeria, India, Morocco, and the United States. So the first countries, the first four that I mentioned, they've been using hydroxychloroquine. And here it says there's a chief doctor in Turkey says it's key to use hydroxychloroquine early. Other countries are using this drug too late. He says, especially the United States. We only use it at the beginning. We have no hesitation about this drug. We believe it's effective because we get the results. So that's what matters is results. Now, the FTC says that's not what matters. In their opinion, what matters is a study. So we're waiting for a study. But the problem is, this is a pandemic. It's short term. It's 3 months. Just like any flu, it's 3 months long, maybe a little bit longer, and then it's gone forever. So the FTC is looking for a study for, let's say, for chronic fatigue, or name a longer disease process. And then you can do many clinical trials, and you can do other studies, and they can take 6 months, a year. And over the course of 5 years, you gather up data, and then maybe you have a cure. And the FTC can approve you talking about that cure because you have, quote, reliable and competent, unquote, research. So what the FTC is doing might be okay for chronic illness, but not for a short-term flu season like this. Now, at the bottom of this graphic, it says that right by this red arrow, the deaths per 1 million population from COVID-19, in Turkey it's 54, in Algeria it's 15, in India it's 4, and for Morocco it's 6. And then for the United States it's 327. Maybe this information is cherry-picked, but the point here is that I have been saying this from day one, that if the United States used a therapy that other doctors have been shown to be successful with in their clinic, 108,000 Americans would not be dead right now, because there are a lot of therapies that a multitude of doctors have used successfully to prevent and cure COVID-19. So I'm not advocating for hydroxychloroquine right now because the FTC might fine me $135,000. That is total tyranny, by the way. And what the problem is that they set this bar so high, nobody can achieve it. Now, the person that posted this, he says, there really is no congratulations. America let 100,000 die without early treatment. And I just need to stop him right there and say, it wasn't America, because that implies you, if you live in America. It's the FTC, a bureaucratic government agency that's actually unconstitutional. Nobody's ever elected to be in the FTC. They're all appointed and hired. And I've been looking around the various letters. The FTC is shutting down all kinds of doctors for curing COVID, legitimately curing COVID. I've been looking through these letters, and one of the doctors actually got a combined letter from the FTC and the FDA. So now there's two bureaucratic government agencies, and they're shutting down cures for COVID-19. Now, if we had the cure, like these people are saying, for like hydroxychloroquine, like the French did and all these other countries did back in February, then we would not have the economic lockdown. We would not have 40 million unemployed. We would not have currently riots now for 8 days because there'd be people at work. So there's a lot of problems that you can blame America when it's not America. It's the government agencies. So let me show you this next comment. So then he goes on for the next tweet, and he says, as with all viruses and diseases, it's the capitalist food system based on value-added profit that is root cause of all disease and COVID-19 deaths, from i.e. that is poor immune system response. And I commented, the problem with the food system is due to the USDA. It's not the capitalist food system. So my next tweet underneath that, it's not the capitalist food system. They're forced by the socialist government to make low-fat, high-carb foods. It is all on the government's shoulders. USDA, FTC, FDA. Now, the USDA has been saying for 40 years that fat is bad. We need to eat high-carb, bad fat foods, convenience foods, high fiber, because fat is bad. and they've been wrong for 40 years, and they're going to release soon, very soon, their upcoming USDA food pyramid guidelines for the next 5 years, and it's going to be the same message that fat is bad. So in 5 years, we're going to have to go through this whole fight once again, because in the USDA Dietary Guidelines Committee, and if you've seen my videos, I spoke twice to the committee, once in Washington, D.C., the other time in Houston. I had my 3 minutes, and I spoke to them. But there's one guy who works at Nestle. He was on the committee. His subcommittee was in charge of investigating saturated fat and a little bit of related to ketosis. This guy works for Nestle, and they sell Slim Fast, and they want people to lose weight buying their product. But if you go into ketosis and you're eating saturated fat, which is the healthiest fat on the market, right, better than polyunsaturated, better than monounsaturated, you'll get strong and healthy, and you can fast longer, and you can lose weight by focusing on good quality saturated animal fat and protein. So again, the USDA failing, FTC failing, the FDA failing. But I have a suggestion. It'll probably never come to fruition, and let me share that with you next. So what the FDA said in my letter, and other letters, I've had other doctors send me their letters too, is that they set the bar so high that we need to have reliable and competent studies to show that a therapy can kill the coronavirus, or a coronavirus, any of the 1,100 coronaviruses. They say that if you talk about a supplement or a drug that kills a coronavirus, there's 1,100, then therefore you are saying that you can kill COVID-19 with that therapy. Okay, and even though that's not what I've been saying, they just made it that way in their letter. They just have a form letter. I've compared my letter that I received last week with other people's letters. It's just a form letter. And there's no thought behind it other than they go on your marketing and they grab words that you say and they put it in the form letter. So they set the bar so high that all the hydroxychloroquine doctors can't talk about their cures. All the ozone doctors, the IV vitamin C doctors can't talk about their cures. The Chinese medical, acupuncture, herbal people can't talk about their cures. The naturopaths, all that's the nutritionists, try to, help reverse your diabetes to get healthier for the immune system for the virus. All these people can't talk about what they need to talk about, because the bar is set so high for COVID-19 and coronavirus, as it is with every disease. But the FDA has not been cracking down on communication related to other diseases for years. But because of this COVID-19 and because of Fauci and Bill Gates, they're going to make billions of dollars on a vaccine. They're throwing money around, and then therefore that's why the FTC, this is my theory, that's why the FTC is cracking down on all these doctors. Now, as I showed you before, 108,000 Americans have died because of COVID-19. I believe deeply that not one person needed to die. Based on the researchers that I've read and based on the epidemiology, and I've said in my previous video, nothing's been shown to mitigate, to prevent, to cure COVID-19. So therefore, nobody can talk about St. John's wort, nobody can talk about face masks, nobody can talk about social distancing, nobody can talk about economic lockdowns. It's all illegal because nothing's been shown to prevent or cure COVID-19. So I live in Michigan. Governor Whitmer is saying there won't be any stadiums filled up until there's a vaccine. So in order for you to go watch a football game, you got to get a vaccine. That's what Governor Whitmer just said today. And that is an illegal statement. She has no right to say that. It is FTC illegal to promote a vaccine, which is exactly what she just did. Now, if there was a different gradient, if we added a gradient to these levels of research, and if the FTC allowed us to talk about, here at the very top, we have a double-blind placebo-controlled clinical trial. That's the gold standard. That is the highest bar that anybody can reach for a therapy or cure for any disease, whether it's natural or a drug. And again, if you have a long-term chronic illness and then people are being studied for 10 years, you can possibly find a study that the FTC says is competent and reliable. But in this short instance of 3-4 months of this flu season, we don't have that much time. So maybe we should use less quality research. It's still competent and reliable, but the type of research is not as high quality as a double-blind placebo-controlled trial. such as a clinical trial. Now we have people like Dr. Zelenko and others that in their clinic, they trialed hydroxychloroquine, azithromycin, and zinc, and they had great success. And they showed that within a matter of weeks. Other doctors using IV vitamin C and other therapies combined with great results, showing that in a matter of days and weeks, that's a clinical trial, but it's got to be under the auspice. It's got to be approved by a board, and then it's got to be monitored for quality. I mean, that can all be done in like 4 weeks, and then you put people on these therapies, and then they're cured. But again, the FTC is saying that type of study is not competent and reliable. They said that if somebody's doing that in their private practice, they just shut them up, and then therefore the therapy is just doesn't exist anymore. It's gone basically. So the next lower quality, and this is debatable, maybe we can use animal models. And below the animal models, it could be an in vitro study, such as in a petri dish. And below that, a computer model. There was a great computer model done where they studied quercetin versus this COVID-19. And then below that, epidemiology. Now, epidemiology might have a better grade or a lower grade or whatever. I put it at D-. But it depends on how the data is interpreted and how smart the person is, how good at math is the epidemiologist. So in this era of COVID-19, I've seen epidemiologists interpret government data on statistics regarding infection rates, fatality rates, and what various states and countries did. I've seen really good interpretations of the efficacy of various therapies and social distancing and wearing masks and all that. So epidemiology might be at B+, or it might be at D- if it's in the hands of Neil Ferguson, who's the guy that shut down the whole economy of the world based on false data. So this should be the law. So right now the law is you got to reach this impossible bar or else shut your mouth. And it's a black or white, there's no gray area at all. And I'm saying there needs to be a gray area, and that's what this is. Now this FTC law was passed in 1937. And I've read, documents of total charlatans, total quacks saying they got the cure for cancer, show up at their hotel, pay for their hotel room, and stay in there for a week, take their therapy, whatever it is, and then the person dies, and the person running the hotel makes a lot of money, and then they later get arrested. The 1930s, during the Great Recession and all that, the Great Depression, it was filled with charlatans like that. So I understand the law passed in 1937 by the FTC, and that was a long time ago, and we have now computer models that didn't exist back then. We have research, various types of research that didn't exist back then. So now we can have this gray area, and then we can think for ourselves, and we can promote a particular therapy. Maybe it's an herb, maybe it's a drug, and we say, look, this therapy is valid in B, the in vitro model, or this therapy is valid in B+, the animal model. So as a consumer, you can decide, well, I'm really sick, and the best we have is a B+. I'm going for it. I'm going to take that nutrient. I'm going to take that drug. I'm going to take the vitamin or whatever. And it's on you as an educated consumer. Therefore, the tyranny of the FTC, FDA, USDA gets thrown off your back. And then, of course, the doctor can come in and they can put in their advice. And they can say, I've been doing C. This computer model shows that this nutrient takes care of this problem. And then the doctor says, I've done it for 10 people. It'll probably work for you. That's my judgment. Together you make a decision. Right now, that does not happen. Right now, it's the government telling your doctor what he or she can say. And then therefore, you are limited to any kind of therapy. I'm going to end off by sharing with you a story that I read last night. And it was an article written in 1969. I like to read old information, old books, old articles on the history of medicine. And it's what is the definition of a quack? So from this article, it was people who went to fair, from county fair to county fair, and back in the 1920s and earlier, and they sold literally snake oil, which is easy to acquire because there's at the time there was a lot of snakes everywhere. People hated snakes. You can kill snakes easily. You chop them with a hoe, chop their head off with a hoe, and then you can extract their oil and you sell it, and maybe put in some mercury, maybe put in some lead, maybe put in some cocaine, And that's kind of stuff that they did. Put in some heroin, and then you sell it, and you say this cures everything. It cures lumbago. It cures psoriasis. It cures dropsy. These words that we don't use anymore. And then the person would sell this at the fair. People would buy it, and then they were gone. And they go to the next fair real fast, and the people take it for 3 days, 4 days. Now they're sick, or now they're worse. Now they're not any better. But it's too late because the person that sold it to them left already, and now they're on to the next person and the next fair. So the problem here is that the patient can't go back to the person who sold them the snake oil and say, I need a refund. That person's gone. So the gist of this article is that a quack does not give refunds. So tell me, post in the comments below, when's the last time you heard of a hospital giving a refund? When's the last time you heard of an insurance company giving a refund? I've given refunds. I don't like to admit it because it means that there was some sort of a break in our system or the person didn't get well. And it's rare that I give refunds, but yeah, legitimately, I have given refunds. As a matter of fact, I gave one last week. But a quack does not give refunds, according to this article that I read, and it should make sense to you, because the person who is selling you a therapy has a particular responsibility to have education and to get you well. That's the free market. So the free market, there's this push and the pull. So there's a demand. Patients have a demand on me to get their body healthier. And then I have a supply. I have a supply of knowledge and nutrients. And then so like we're going back and forth, and we're trying to match up the supply and the demand and make it work right. So, and if it doesn't work out, free market says the person's unhappy, they could easily go on any social media. They can go on Facebook, Twitter, YouTube, whatever, and say a bunch of mean comments about me. And and I don't want that to happen. I want to get people well. I haven't taken insurance since November 1st, 2005. That's 15 years of total free market healthcare. And therefore, I do end up giving a refund every once in a while. But again, does your hospital or medical clinic or insurance company ever give a refund? If they don't, that's not free market, that's socialism, that's quackery. All right, they're insulated from getting you well. All right, there's my tirade. I got a bit of a soapbox mentality ever since the FTC made me take down 13 videos. And I have not received an answer back yet from the FTC lawyer. I sent him 2 emails last week, and I'm patient right now, and we'll see how it goes. And I'm thinking about, like, what do I do? How do we change the law? And so my idea of having these gradients of research that we can rely on, we know how good they are or how bad they are, but at least we know. And it doesn't make it impossible to gather up nutrients and other things based on mediocre research. That might be a solution, but it takes a lot of work to change the law, right? So, but again, it's not just the FTC. They have their one law, but the FDA has 4 laws. So in order to get the free market back into the medical system so that your medical doctor or your holistic doctor or whoever can actually work with various therapies and apply it to you as an individual, we're gonna have to change at least 5 laws and put in a writer or change a section or delete a sentence or whatever. I don't know what it's going to take. Anyways, there's my video for today. I hope you like it. Give me a thumbs up, share and subscribe, and maybe send this to a politician. I don't know. Okay, see you at the next video.